get a good walk to the podium, you know. Try to get 10,000 steps a day, so this helps. Anyway,
Thank you.
all right. I start by saying my desire to have Dr. Graham come to speak about prostate cancer basically came about when Joe Biden was diagnosed as advanced prostate cancer, which is about a month and a half ago, it seemed. And I had actually lined this talk up, and somehow the date got mixed up, and I had you July 11th, and it was supposed to be July 10th. Dr. Graham was doing lots of surgery on on July 10th, and so we postponed this to this month. So anyway, it gives me great pleasure to introduce to you all my friend and fellow urology colleague, Dr. Richard Graham. Uh, Richard is from, as the Yankees say, Stanton, a native of Stanton. Was an undergraduate at University of Virginia, med school at MCV and had urology training after some surgical training out in the West Coast, back to UVA for his urology residency. His CVA is extensive, uh, C, CV rather, not CVA, with many types of treatments. He's a skilled laparoscopic surgeon and has had lots of other subspecialty training. I've published a lot of articles. He is a very good urologist, and they were fortunate to have him come after he practiced for about 10 years in Richmond, and then practiced another 10 years in Vermont. And fortunately, when I was about ready to retire, why, he was interested in coming back to Richmond, and so he is now a Bon Secours urology participant, and gives me great pleasure to introduce to you Dr. Richard Graham, who will speak to you about prostate cancer. Sorry that a few more prostate havers weren't here, but we'll give them some booklets.
Thank you. It's tough to follow a legend. I came into Petersburg and fought Dr. Bigley, and I had to kiss the Barney Stone and had to grovel for 2 years. But I got it up my knees now.
We know how to.
Yeah, it is. Anyway, my brother's urologist, dad's urologist. I went to college to play sports, ride a motorcycle, and have a girlfriend. One of the goals I had in life. And I started working at a urology lab, and they recruited me to go to medical school. So I did 4 years research in that, MCV, worked in Boston a little bit, went to San Francisco, came back, and I was supposed to go to Great Ormond Street in London and work there, but there was a guy named Ed Hill, and I said, Dr. Hill, I'm a chief resident at UVA, and he's a friend of my dad's. So of course we do. You give him grief. You're not gonna let him do anything, right? And I said, well, I'm coming to Richmond to practice. He says, you're what? I'm gonna come practice, put my shingle right next to yours. What? Yeah, I'm coming next year. You are? I know that. It was all BS. I was going to London. I didn't tell him anything. And then later, ended up getting married and took the job. It's just one of those weird things in life. And they had this new thing called laparoscopy in about 1980s, late. And I started doing it. Thought it was kind of fun. Next thing you know, I'm operating all over the world. And the funny thing was, when I went to UVA, there was a guy named Chuck Brindler who sat next to me, and his father was a urologist. And so I was going around the world doing lymph node dissection, laparoscopic for prostate cancer. And this new thing came out called PSA. And so I turned to Chuck, I said, I saw him at a meeting, what's stuff about PSA? Oh, it's just garbage. Come on. Steamy, he's out on the West Coast in Stanford. This week it's pink elephants. Next week it's green trees. This week it's PSA. It's always something, this guy. It's nothing. No, he was lying, but he didn't know. But that does make a difference. So the question is, what is PSA? PSA is a rape test. That's what it came for. It had nothing to do with prostate cancer. what happened was this guy named Sensible said, hey, this guy raped this woman. He said, no, he didn't. What do you mean, no, he didn't? Don't have any sperm. Can't prove it. That was before the DNA test. What do you mean? We got to find a protein that goes with sperm besides sperm cells. Huh. Okay. So there was a protein called kallikrein 3 that makes lumpy sperm swim faster. Okay? We'll call that PSA. Prostate-specific antigen. We're going to make billions in court. Come on. It's the deal of the century. Of course, they, being male, they assume men do everything, right? Reality was, of course, women make PSA. Women have orgasm. Women have a prostate. Did you know that? And women have a prostate too. I've had 2 patients of mine, they're female, have prostate cancer. Okay? So you can get prostate cancer as a woman. It's really rare. You don't have testosterone to make it worse, but it's possible. So when you step section, we used to call them skeins, ducts, or whatever, they get PSA in there. I mean, what God is going to design a system where fertility is based on the man? Come on. God's much smarter than that. He's going, okay, whatever, buddy. Because when you have your orgasm, she has her orgasm, she puts out the fluid, makes sperm swim faster, then the vacuum cleaner comes down, called the cervix, sucks up sperm. That's the orgasm for a female, and that's fertility. All right? Now it's got stuck. So then Stevie picks it up and starts to find out it correlates with prostate disease. It can go up for any reason, not just prostate cancer. That's key. Now, why I bring this up is because I hate that guy. Because I got free trips around the world. I'm going to Russia, South America. Oh, I'm from Stanton, Virginia. Come on. Great trips, free food, caviar, everything. And all things think of PSA comes up, and my life is over. Now I have to go back home and work. It's terrible. Anyway, so it's something important. And then for a while, PSA was being used. And there's always too far, right? You go too far this way, too far this way, too far this way. So what they found is that everybody's getting biopsies of PSA going up and down. And then all of a sudden, the urologist, for a few years, quit checking PSAs. And then all of a sudden, we started to find prostate cancer that was controlled for years, took off. Why? They weren't checking PSAs anymore. So, well, don't need to. Why? It may not be prostate cancer. Yeah, I know. But it may be. And the question is, I tell patients, it's like you're in your Jeep in the middle of the field, drinking beer with your buddies, and all of a sudden the birds fly up behind you. What was that? Did bird fly up over here? What was that? I don't know. Did bird fly up here? I don't know. What's that? What do you know? The birds are flying up. You don't know why the birds are flying up, just know they're flying. But they flew up here, and here, and here. Something's moving. That's all you know, right? You don't know anything else. That's a PSA. All of a sudden, you get there, you get your shotgun out. Oh man, I was one time, I've had this once in my life called deer fever, or buck fever. You have a shotgun with you, and the dogs are chasing a deer. Now, I'm not a deer hunter, but I'm with these guys deer hunting, and the dogs, and you get this fever. I just can't wait to pull the trigger. That deer's coming. I'm going to shoot him, and your son walks out. Hey, Daddy. Okay. That's why the bird flew up. Nothing to do with anything else. That you get that buck fever is the same as urologist with a biopsy guy. Can't wait to pull the trigger. Oh man, I'm going to biopsy him. Okay. So the reality is, when you look at PSAs, which is a test the doctor will get for the men, is that they're watching PSAs. So if this blood test goes this, that's prostatitis. How many men do I see a day in my office prostatitis? 10 or more. If you're a forklift operator, you got prostatitis. I have 70-some patients of mine that are forklift operators. Now, I know you know 70 of them. I don't know about 70 of any profession. All forklift operators, right? They come in, and they all get vibration. So they come in for 3 things. They're 23 years of age. They come in because they're impotent. Totally impotent. From prostatitis. Inflammation of prostate glands. In their 40s, you come in, low frequency, plus that. And sometimes the PSA starts to go up. So that's one of the reasons people come in, PSA is doing this, right? And Dr. Bidley would tell you do a rectal exam. Every once in a while, you think it's prostatitis and you're burned. Oh, it's prostatitis. That ain't prostatitis. You do a rectal exam, you feel something rock hard. You go, it could be prostatitis, but, you know, and PSA is 5.7, but rock hard prostate, a young guy, you feel that, you got it early. And it's usually very aggressive prostate cancer. All right? Now, what is the prostate, right? What's the purpose of it? Skunks have them, they get prostate cancer. Humans have them, horses have them. Prostate holds all the juice for orgasm. So when a man has sex, 99% of orgasms from prostate. This is how much comes from testicles. That's it. If you go to Home Depot and your husband, your significant other goes and he goes get mauve paint for the family, right? Guy says, the family sent you. Yeah, mauve paint, huh? Okay. But it's a big can of white paint. It's 16, it spins around, goes, right? Shakes it up, gives you that sperm. Why that's important? Because when you have a vasectomy, you think, same amount of fluid. 99% of your fluid is still there. It's off in the prostate, and it's right under the scrotum and the perineum. So if you're driving down the road and you're male, you'll bounce. If you're a truck driver, you get prostatitis. And so guys come to me all the time, oh my God, I got cancer, I got PSA is 4.4. No, you don't. What do you mean? No, you don't, you got prostatitis. So you put them in, you check the prostate, does it feel like cancer? Mushy, tender, and you say, I'm going to do a rectal exam and check your prostate. It burns down your penis, your prostatitis. Oh my God, that hurts. Yeah. You put them in antibiotics, bring them back, PSA goes, after antibiotics, down to 2. So you follow people, don't get me wrong. But the point being is, PSA is just it's a test, but it's not a cancer test. And that's important. And you want to go home to you should have a check. And you say, well, doesn't make a difference, it's not cancer, I don't need a test. That's not true either. We pick up a lot of prostate cancer on the PSA. And you're not looking for necessarily a level. You'll see a PSA, it's supposed to be up to 4. You'll see a PSA of 2.5, which is prostate cancer. It was 0.6. It was 0.7. It was 1.0. Then there was 1.5. Now it's 2.0. Now it's 2.7. Like this. All in a short period of time, go, ooh, something's growing. Again, you're watching the birds go up and down. Birds are flying. Something's going on. That's what you have to know. So it's actually the delta is more important than the value. Now, if a guy comes in a PSA, which we've seen of 3,000, it's a little high, considering 4 is normal. We see a lot of people in Petersburg, PSAs in the hundreds. That's prostate cancer spread. You may see an infection, PSA of up to 100 a gallon, about 100. You may see with a UTI. You can see high PSAs, blood test, from infections. But usually it's going to be prostate cancer, very high. So it is a test. And you have guys, you should check the prostate, check a PSA. Guy goes for attention to Petersburg, it's prostate cancer proven otherwise. Now, prostate cancer usually doesn't cause blockage of the prostate until it gets advanced. If you think about it, prostate's like an orange. You got the rind, right? And you got the pulp on the inside. 95% of the time, prostate's in the rind, not in the pulp. So for prostate cancer to block you, 95% of the time, it starts on the outside, has to grow in like this, right? To get the blockage in the middle of the prostate. That's your donut around the bladder neck. If it's growing in like this, your PSA is usually pretty high. It's not 2. It's higher than that. So you start getting obstructive symptoms, it could be prostate cancer. 95% of the time it's not. 5% of the time it's in the middle of the prostate. It can cause a blockage. All right? Why that's important? Because you think your husband, he gets to pee more often. It's probably prostatitis. The way I think of prostate cancer is like when I was a kid, and I'm older than most people in this room, except for Al. It's hard to believe, but it's true. Well, I'm in my 70s. If you're older than that.
Not yet.
Yeah, that's right. So I'm not lying, am I? And remember, when my family dies, my parents died at 103, grandmother 106, Other grandmother died at 95, but she smoked 2 packs of cigarettes a day. Go figure. But anyway, given that there was a movie called Cleopatra came out. And I was a kid, I don't know anything about Cleopatra, but I was like this, and all of a sudden you have this famous actress,
Elizabeth Taylor.
Elizabeth Taylor, and it has a snake that goes around the back of the chair and bites her.
Oh.
I'll never forget that. I'm a little kid going, oh. And that's prostate cancer. You don't feel it, you don't see it, you don't have symptoms, it bites you. That's the key. You gotta know it happens. Runs in families, yeah. You know, my brother has it, my father has it. I've been biopsied once. My other brother's been biopsied 3 times. You know, I've told him, go for 4, Gordon. Well, you've had it 3 times. Come on, you can take it 1 more time. Get a prostate biopsy, just for fun. But again, it does run in families, but it's very, very common in Petersburg. More common in black males, farther advanced. My family, no. It's very common in my family. I'm black, I don't think. But all the stuff you don't know who has prostate cancer. So you can't make assumptions. The worst thing you can do is, oh, they have this and that because they're this and that. No. Never make assumptions about people, right? Never. So you say the person comes in, they're going to be anybody. You check them out. You treat people like your family. How do you want to be treated? That's why I'm down here. Give you a short story. When I was chief of surgery in Iraq, I did the first robot prostatectomy in America. Wow, huh? A friend of mine started the company. I played this toy. That's all it was. But the reality is, I did all that, right? Took care of governors and all those people. I come down here, much nicer. Your chief of the hospital here was my former nurse, the CEO. And she goes, what do you think about being down here? You were in Iraq. I said, oh, much better down here. Wow, people are nicer. People might appreciate what you do, but nicer people, the staff is nicer. You don't have the arrogance. You don't have to deal with some guy walking with nose in the air. You know, thinks he's or she's somebody. You know, so I'm saying, you ask all my patients, all my family, come in the door, I said, see that line right there? Walk in, you're my family now. You tell me what you need, I got your back. I'm not a big fan of insurance companies. Not a big fan of, you know, a big hospital. I'm not here to steal your money. You know, I'm here to help. I'm in my 70s now, I do what I want. I follow Al Bigley's example. But getting back to prostate cancer is that you think about it, the pulp of an orange, it blocks you. And that's where all the sperm is made. You think of orange like that, right? So if you're bouncing, it gets swollen. Like hit yourself in the shoulder 1,000 times, it swells out, right? Well, pulp will swell shut so you can't pee. So prostate cancer is on the outside, right? So that is important because you do a rectal exam, you're feeling the outside of the prostate. And often it's posterior on the prostate, which is where the cancer is. So you feel a nodule. Now, you'll find patients, we used to do, only test we had was that, and something called acid phosphatase, was basically pretty much a worthless test. It wasn't a great test, right? It didn't, so we had an notch test and a rectal exam. So the PSA is better because you pick up prostate cancer earlier, and you can make a diagnosis. But you got to, again, know if the PSA is doing something, what's it doing? Why did it do that? You know, your son's acting funny, comes in, you tell me this story, what really happened? What really happened, son? Right? You got to know what the reality is. You analyze, you figure out what's going on, make decisions based on that. Now, as far as treatment, you can take the prostate out, you can burn it, set it on fire, you can take it out and freeze it to death, you do all kinds of things. All you do is get rid of it. There was a friend of mine, I did the first prostate, right? I did the second, I haven't done any since. I know, you know, I'm a kidney surgeon mostly, but I do a lot of prostate cancer, but the radical prostatectomy, no, it was my brother's, his main thing, and the part is Dr. Park, who's here, I hired 20 years ago. That's what they do. But I got a friend of mine, and he's done 20,000. He did the surgery in 45 minutes. And people say, oh, it's a robot. I said, no, it's not. If he did it with a sherbet spoon, was that good? You know, you got a little sherbet scooper, you can get it out that way. I go that way too. He has incredible results. He's really good at that. But if you're a surgeon that's really good at open surgery, not good at robots, you don't want to do no robot surgery. If you're really good at robots and not good at open surgery, you don't do an open surgery. And we see that. You know, it's true for all surgery. If somebody says they've done one, you say, hey, I mean, I've done 100. Right? If you're done 100, well, I've assisted in one. That ain't what you want to go see. You're not asking what your group has done or what people in university done. How many have you done? What have you done? I have people come see me for all kinds of things. If you haven't done them, go to somebody else. Anyway, he's doing 20,000. So I'm saying it's not the surgery. He's very good at it. 45 minutes, skin to skin, 5 little holes, and the surgery's out. Perineal, underneath the scrotum, between the anus is the perineum. That's the original way to take the prostate out. That's how my brother did thousands that way when he was the chairman at Emory. Take it that way. That's fine. That works. They all work. Just getting it out. You can radiate it, stuff like that. If you're in your 70s or late 60s, you may want to do radiation. Why? Cure rate's about the same. Complication rate's less. You take the prostate out, they don't tell you these small details. Well, the prostate's part of the urethra. You got a man, right? Take his prostate. He has a big prostate. Say that to home. I take that prostate out. Now I have to hook the urethra to the bladder. Ooh, I got to pull both together. What does that do to the penis? Well, you took the urethra. You took part of the urethra away, so that penis is going to get shorter. Right? Now, continence controlling his water. He don't want to wear a diaper the rest of his life. You know, right? Impotence. Penis won't go up. 3 major complications of open surgery, or any kind of prostate surgery. I was in Virginia Beach one day after I'd done all this stuff, and I pulled into the Italian restaurant. I had 2 little boys that had to go to the bathroom. You know the boys are. Just outside the bathroom, and don't break anything, don't spray each other. And this guy walks up to me, and his wife owns the place. He says, "What do you do?" I said, "I'm a urologist." He said, "You son of a bitch." Excuse me? Okay. I said, "You ever heard of the robot prostatectomy?" No, never heard of it. And he goes, "I had it done. I'm 48 years of age. I've lost 3 inches of length of my penis. I'm totally incontinent. I'm totally impotent. 48 years of age." He said, "There are 40 of us here in Virginia Beach that have that problem." To do that with open surgery, you have, as a 2% complication rate, you have to do like 8,000 operations to get that many complications. They hadn't done 8,000 of these things. They done a couple hundred. But that day, you don't go to that guy, whoever it was, do the surgery. Right? And that's what the lesson I put to you. Go to somebody who does a lot, who's very good at whatever the operation is. I don't care, orthopedics, eye surgery, urology, it's all the same. All right? You just got to know that in small details. So, surgery does radiation. The side effects usually is frequency. You'll pee more often. They radiate. The old days, you put prostate in the radiation, you turn the beam on, and you breathe in, right? And all of a sudden you burn the rectum, you burn the prostate, you burn the bladder, whatever knows. You burn everything, right? Because you're breathing. So people come in with burns, they had fistulas, anus problems, all kinds of problems. Then some bright person figured out you put a little piece of metal here, a piece of metal there, and you can move with breathing. So the machine moves up and down like this. What does that do? Well, you're no longer burning other areas, just meaning the prostate. And now we put gel, like Jello. You squirt it in between the rectum and the prostate before this. It lasts about 9 months. They'll do radiation a few months after you make a diagnosis. And won't burn the rectum because there's a spacer in there. Okay? So what you're really burning mostly is the prostate, maybe a little bit of the bladder. You still have the frequency. The impotence rate's less. So if you're in your 70s, you have prostate cancer and it's localized. Cure rate is almost as good as surgery, if not better, depending on who's doing it. And the complication rate's less. And here I'm taking money out of the mouths of my children. I mean, food in the mouths of my children, telling you the truth. But the truth is what you want, right? So for an older group, radiation works very well. Cryosurgery, put needles and freeze things. I used to go around the world and do cryosurgery for kidney cancer. I was lucky, but the needles we put in cancers is from the missile guidance systems for Israeli aircraft. That's where it started. Weird, huh? The guy, some company called Galil, right? And the guy, one of the founders' name was Uzi Galil. Needless to name, he had other patents. And they did this, they had the swallowable cameras. That was part of it. And a friend of mine that started a robot company was going to buy the cameras from the Israelis. Then he started Da Vinci. But these freezing needles you put in people, they turn hot and cold, and he put things in the freezer, kill it. Now I use them for small kidney cancer. It's amazing. Instead of taking the kidney out or operating the kidney, you can do that. It kills small cancers. When it works for the prostate, same thing. Again, if you want to kill prostate cancer, or kill prostate, you can burn it, freeze it, whatever it is. You just destroy it. That's what you're doing, right? Freezing does trouble. The trouble is, for a man, the incidence rate's 100%. Most people don't want to sign up for that for a guy. Guaranteed it won't be potent afterwards. So that's not a great cause, and I'm not sure it's as curative as radiation is. So that's where we reserve it for people that have had radiation. And the other lie you'll hear, I think it's a lie. People say, well, you got bad prostate cancer, and we can surgery it and take it out, and if it doesn't work, get radiation. Okay, sounds okay, but what does that really mean? What's the cure rate with surgery? Well, it's good. What's the cure rate? 25%. Oh, so I got 1 in 4 chance you'll cure without radiation, but 75% chance I'll get radiation too. So what am I radiating now? I'm not radiating the prostate, it's gone. I'm radiating the bowel. I'm not radiating the bladder, directly radiating it. So you get the complications from surgery and the complications of radiation, right? And that's for the really high-grade cancers. That's not true for every cancer. But if you have a very aggressive prostate cancer, you got to tell the patients the truth. I probably can't cure you with the surgery. Radiation has a 75 to 80% chance of curing it without anything else. And you can go back and do cryo on those people if necessary and freeze it. Trouble is, if you have very aggressive prostate cancer, sometimes no matter what you do, you're not going to cure it with local therapy. And that's what you have to know. So, you can buy into this, you can buy into that, but, I spend all my time telling people, I don't do any of it. I'll put the gel in there or whatever. But I can tell you what I do. I'll go through the system, why you should do A, why you should do B, why you should do C. I'll give you a reason. And I'll say the person does all that. I don't do the robot prostates anymore. Been there, done that. I get the other guys. But if you need something done, well, it's important because these people need to be taken care of. So if you have a young husband or son, whatever, if his dad had prostate cancer, he's a higher chance of getting prostate cancer. 10 times the risk. If his brother had it, even higher. I have families where the brother had it, son had it, grandfather had it, everybody has it. And the prostate, instead of coming at age 50 for prostate cancer, coming at 40. So you go back 10 years, no matter what it is. If you're, somebody's family had prostate cancer at 50, you better get his son checked at 40. So you go back earlier, and that's important. So it runs in your family. Or if you don't know your family history, we see guys all the time. I had a guy the other day, 51 years old, prostate cancer. His PSA came to see me at 10. He was a prisoner. 51, no family history. Prostate felt okay, he felt a little funny. And so I checked my own test. So maybe they're wrong. He was 15. From the time they'd drawn it, the time he saw me in 2 months, he'd gone from 10 to 15. That's not a good sign. So he had very aggressive prostate cancer. No family history. But it can happen. So my suggestion would be if you have family with anybody, to have it checked, to have the PSA checked, have them do a rectal exam. Something doctors don't do anymore. Doctors don't do physicals anymore. You ever go to a doctor? They do a physical anymore? No, they have I'm over a CAT scan. What? I got a back pain. I'm over a CAT scan. Did you check the patient? Check the patient? Why not? Well, I do it all the time. I have people come see me all the time with flank pain. They have a small stone this big, not in the kidney or not causing a problem. They have flank pain. So I bend them over, go, my God, you have musculoskeletal pain. You have a tick. What you used to call a tick, right? Muscle spasm. Put your finger, do it again. Same place, same pain. It's not a kidney stone. They want to order a CAT scan. Do a physical first. See what it is. If if you can't figure it out, yeah, fine. Don't spend somebody's money. That's $3,000. That's money. That's out of your pocket, right? I don't believe in that. You do a physical exam, and I'm hoping more younger physicians do that. But I will tell you, they don't. Younger doctors don't examine patients half the time. They'll talk to you 2 seconds, and you walk. What do you say? I don't know. They leave you You left me a paper. What's this? I can't read the paper. Right? Does that sound familiar? You guys seen that? I mean, I see it all the time. So I can tell you, as an older physician, you see it. My advice is you go see a doctor, have a list of questions for him. List of stuff. You know, whoa, before you leave, doctor. Whoa, come back here. I just want to get a couple questions. But, yeah, I know I'm obnoxious, but I kind of ask a couple questions. It's worth it. Because it's your life. Don't depend on the doctor to do everything, especially these new medical systems where they're pushing doctors to see patients and they're pushing people through. And these young doctors, you know what their job is? What time do I get off? How long is my vacation? Right? Somebody comes to ask me for a job, and the first question they ask in any business, right? How much vacation time do I get? Well, I don't know. What do you mean? You're not working here. I don't know where your vacation time. Right? I'm just saying, in general, that's the way life is. All right. Any questions? Anybody have any questions? Questions? Answers? Yes, ma'am.
Yes,
Donations. Go ahead.
my husband died in 54 of prostate cancer.
Okay.
I have no daughters,
Okay.
only 3 sons. So you're telling me
How old was he when he died?
56.
Okay. Then they all should be checked. All of them. It does run in families in that if your grandfather had it, I'm just saying if your grandfather even had it, your mother's father had it, you're slightly increased risk.
Right.
Your sons, yeah, no question. How old are your sons?
They're in their 30s.
Yeah, I would say at 40. Why? Go back at least 10 years. You say, oh, we don't need it done. Yeah, go to your office. Seen a lot of this. Where do they live?
Boston.
Yeah, well, I have friends about all over the world.
I got my cancer treatment at Mass General Hospital.
That's where I used to work. I did research there in vascular surgery. I told you I worked in Boston. Yeah.
Oh, okay.
I worked at MGH.
Okay.
And then I did something very bad. I did. I proved the chairman of vascular surgery as a medical student his research was wrong. And then I showed him. That's why I trained in San Francisco.
That's it.
I had to get out.
No.
It was a no-no. The chairman of the nicest man I've ever met in my life was chairman of surgery at Mass General. Jerry Austin. He was amazing. He was like my dad. And so when the chairman of vascular surgery was great, like my dad, but when I told him, showed him his research, that was 2 years of research down the drain because he missed a big variable. I'm a medical student. So, I better leave. Time to go. But no, MGH is a great place. And I have Mass on here, great place. They're all really good.
They're attached.
Yeah, so I would say that if your sons are up there, tell them, go 10 years back. Dad passed on at 50. You have a higher chance, go back at least 10 years. It's true for all cancers. If your dad had colon cancer at 50, the kid should be checked at 40. And that's the exception to the rule about checking PSAs. The rule is 55, whatever, unless your family history is like that. And so I would definitely have it checked.
So you can check your blood with
Yeah,
PSAs
PSA,
to see if there's cancer.
Well, it'll tell if your PSA is up. Your blood test goes up. And the PSA is a test. It's not a cancer test, but it is a test. It does go up with cancer. So there's a little difference between this and that. But somebody needs to know that, because I've seen men come in with prostate cancer in their 40s. And you want to keep your sons alive, right?
Yeah.
I got 4 sons. I know it works. I know it. Look, trust me. They're bigger than I am. Some are 6'7". I walk in and they go, yes, Dad. You understand? They may be bigger, but they're not meaner. Yes, ma'am.
I was just so engrossed in your presentation.
Did you fall asleep?
No.
I would have. Go ahead.
Engrossed.
Okay.
So interesting. But seed implant, is that still?
Okay, let me tell you about seed implants because I'm not a big fan of it. My dad had it. My dad had prostate cancer at 78, starting to spread. He's president of American Urology from Stanton, Virginia. Nobody's in private practice ever in practice, but he was. And he asked me, he said, I'm 78 years old, PSA's gone to 18, it was 3, 8, everything took off. And, the question, lymph nodes are getting bigger. He got the Lupron shot and then got seeds. And then external beam both. I'm not a big seed fan. External beam probably has a cure rate the same. Seeds really, really scar down your urethra. So what happens is these guys get seeds. The scarring is so bad they can't pee. And they're coming to see me. They have the seed implants. Right? Now you got to cut that scar. I cut the scar, 50-50 chance of being incontinent. Ooh, that's not a good sign. So you kind of go, external beam, you don't see the gamma radiation. You'll see it from people that have repeated laser surgeries to the prostate, get scarring like that. But the seeds really do it. And we used to do it with low-grade prostate cancer. Great, Leeson 6, really low-grade stuff, which people have. That's not the cancer that spreads, but Leeson 6, you put seeds in. Now we found out if you have Leeson 6, you probably don't need anything done. The cure rate is the same without doing anything. To low-grade prostate cancer, like any biopsy, it depends on what the grade is. That's why the PSA is going up. You have Leeson 6, okay, what do you do about it? Follow it. Do I do radiation? No. Surgery? No. Just watch them, see what happens. It starts to grow, comes back, you biopsy them again. Starts to be a problem, then you'll address it. But again, you treat people like your family. You go each stage, you individualize treatment depending on what the patient has. If you biopsy somebody with a really low-grade prostate cancer and all the biopsies at Leeson 6, over 50%, maybe I'll do something. Something's going on. Got a guy with PSA at 2.9, in fact. Every biopsy is positive, Leeson 6. You got to use some treatment. You get a little prostate nodule. So when you ask about the seeds, I don't like them, and we used to do a lot of them. That was really prevalent in the 80s and 90s. And, you know, the radiologist gets paid, the urologist gets paid, they all get paid. But not the way I think. What do I want done? External beam with present stuff, with the present technology, is probably as good with seeds. And I have people come to see me and say, what do you think? I said, I wouldn't do the seeds. Because I've seen what happens, the complication rate. Again, when you do something, what's the outcome? You can't. You don't care what you're going to do. You're going to go to the pool. You go to the pool. All right. What's the prediction? What's going to happen? What's going to the outcome's going to be? Right. That kind of stuff. So my suggestion would be, I'm not a big seed fan. External beam. They do a really good job here. Speaking of Petersburg, remember I worked at Harvard. I worked at Duke, Hopkins. I used to teach a course in laparoscopic cryosurgery at Duke. I don't got the weird bad things. Anyway, all right. Yes. Good. All right. Go ahead. The last question.
Quick question, for the PSA test.
Yep.
Is that part of the regular?
No, it's not.
You have to ask for it?
You have to ask for it. I mean, I think it should be regular. Because people got away from it, they're going back to it. Yeah, if it's a male, yeah, they should get a PSA once a year. I would. And prostate cancer continues to grow in your 80s. So don't think, oh, I'm 75. God didn't make that number 75. You know, so 75 don't check a PSA. Well, your PSA is doing this. God didn't say, okay, you're 75, you're good. No. I had a guy like that came to see me, his PSA went tick, tick, tick. And they didn't check his PSA, and when I checked it was 3,000. It spread and covered all his bones. I went, why didn't they keep? You know, you just you treat people like, again, treat people as individuals. If your PSA is less than 2, you're 75 is doing this, you're probably going to be fine. Right? If your PSA is doing this, don't quit checking it at 75. Because, again, I expect in my family, everybody lives to be 100 or so. Come on. All right.
Thank you so much, Dr. Graham. Here's a pen in honor of coming in here, so you bring that to the office and use that one. Great presentation. Thank you so much, and thank you for coming out today.
Have a nice day.
All right, now, on to the raffle drawing.